Welcome to Encouraging Wellness, where we shed light on the plethora of holistic healing and wellness methods so you can give yourself the power to ask why and become bigger than the condition you are dealing with or the illness you are currently fighting. Join Pamela Worth as she sits down with doctors, medical experts, healthcare practitioners, and those with unique healing stories to dissect groundbreaking practices that combine traditional Western medicine with alternative modalities. Hear conversations that empower you to go beyond hurtful stigmas, outdated practices, and unnecessary labels, guiding you towards a healthier and happier you. Here, we highlight your true worth and help unleash your inner courage. Now your host, Pamela.
Hi, this is Pamela with Hello Health and the Encouraging Wellness podcast. And today I am super excited to invite Susan Gillispie, who is a nurse practitioner specializing in functional health. Susan, did I explain that correctly? It's an incredibly long and important title.
You did. And as a nurse practitioner, I've been trained in, Western medicine, but I found that Western medicine is all about pharmaceuticals, right? You go in, you have a problem, give you a pill. So I have found that to be very frustrating. So functional medicine, we work really hard to try to get down to the root cause of the problem.
So, and I think some people have heard about functional medicine versus what is considered integrative versus what is considered regular or allopathic. Can you just maybe touch on the differences between these?
So allopathic is pretty much that Western medicine model that, we talked about, that most MDs, nurse practitioners, physician assistants are trained in. Go in, you have a problem, solution tends to be pill of some form, right? High blood pressure, you get lisinopril. Technically, first line treatment for high blood pressure is lifestyle changes, but our system doesn't allow the providers time with our patients to talk what that looks like for the patient. So we do the easy thing, unfortunately. We give you lisinopril or amlodipine or metoprolol or, there's a gazillion different ones out there. Functional medicine, I look at that, look at the high blood pressure, look at the patient and talk about maybe some lifestyle changes. But to do that, I have to get to know the patient. What's going on in lifestyle? What are they eating? What are they drinking? What's their family life like? What's work like? What's their stress level? So we're looking at more of a holistic view on the person.
Awesome. And tell me the difference between functional and integrative. Is that pretty similar? It's
pretty similar. Yeah. Same idea, actually.
Okay.
We all have fancy words for everything.
Yeah. There's definitely different terminology being thrown around, but I thought it was pretty similar. I just want to make sure it didn't have some sort of major difference. So tell us a little bit about you and how you got into health and wellness. What really prompted you to become a nurse practitioner?
So I was an Army medic. So I've actually been in medicine in one form or another for over 30 years. So a little bit different. Army medics, we're trained just to save a life. So, I've got that down in spades. Through some family trauma actually is what led me to nursing. My husband decided to go try to kill himself in a car accident and spend 3 weeks in ICU. And I realized the care and just the caring of the nurses really impressed me. And I've always been thinking about medicine and, what I wanted to do. But I had 4 young kids at home and husband worked. So I raised kids. But after that, not knowing if my husband was going to ever go back to his career, I was actually signed up for college courses, right? Actually, when he was still in the ICU, because I had to do something to support my family. I got a degree in biology. The economy crashed. Maybe teach high school biology, love biology. And then I applied for nursing school and got in. And that just kind of set my career path. Fell in love with it. I did a condensed nursing course since I already had a previous bachelor's. So I did my BSN in 14 months. Pure hell, mind you. I learned how to drink alcohol during that time. And then it wasn't too long after being a nurse on the floor and realizing what the doctors were doing and how things were happening. I wasn't real impressed with, so I thought maybe I could do better. Applied to become a nurse practitioner, got into Georgetown first time, and everything else is history.
Pretty cool. So when you did the condensed program, just out of curiosity, how long did it take?
14 months.
Okay. I mean, that's pretty incredible.
It was pure hell. Let's face it. It was full-time. School and clinicals, barely had time to sleep.
Yeah, I can imagine. And then how old are the kids at this point?
10, 12, 14, 16, I think.
Wow.
Yeah.
Yeah. No, it's that's crazy hard.
It was, but so well worth it. My husband was great support. The kids were actually very involved in my education. I had stacks and stacks of flashcards the kids would run through with me. My oldest was a little bit of a Nazi about it. If I didn't recite word for word on the flashcard, he made it wrong and made me do it over and over and over and over. Yeah, but the kids were really involved in it. They probably learned as much as I did in a lot of ways.
That's awesome. So tell me a little bit about, you have your own clinic now, right?
I do, yeah. I never thought I would ever own my own clinic, but here I am.
Yeah, and that I'm sure has another whole host of things that are new and different that you're learning and becoming a small business owner at the same time, in addition to treating people, right?
It is. Diving into the land of insurance and insurance reimbursement, that's been very interesting. And I'm one of the only functional medicine providers in my geographical area.
Yeah. So, I mean, and that's super that you're nice enough to take insurance. Most functional doctors try not to because it's just so painful for them.
It is a big hassle, but I'm here to take care of my patients. Everything else works out in the end. And that's exactly how I look at it.
Yeah. So that's super. So in terms of your practice, do you find that there's certain things that you're seeing more than others? Do you see all ages? Do you see certain conditions that you're finding more of? I would imagine with time, things kind of ebb and flow in certain ways. But
well, I see everybody. Cradle to the grave is kind of how I look at it. I'm one of the only people in the area that will see pediatrics that are unvaccinated. I really believe that vaccination should be an informed consent process and no one should be forced to it. Parents should make that decision for their children. So I really support that, and I will see these patients. So my pediatric practice is kind of blooming because of that. So I do see all ages. I see a lot of people who are dealing with fatigue and digestive issues are two of my big ones. Muscle aches and pains are another one.
So when you see folks with digestion or, anxiety, depression, stress, what are some of the things that you kind of run through in terms of your protocol or your checklist? Or
my favorite thing to do, and people can afford to, is do a micronutrient testing. So I'm looking at all the amino acids and vitamins that the body needs. Most of the time, there is a vitamin micronutrient deficiency that we're looking at. I can almost count, it's almost always vitamin D to start with. But then we move into the other B vitamins that are low, or glutamate, or all these other ones that can be low. And if we address it at the root cause, we really fix the problem versus, again, a pill, pharmaceutical formulation that is a Band-Aid. It's not fixing the problem, it's just giving it a Band-Aid.
So when you run the micronutrient testing, which I'm a big believer in, how much does it typically cost, and is any of that covered by insurance?
Unfortunately, no. I can occasionally get insurance to cover B12 and vitamin D, but unfortunately, as you know, that's not the whole. I found a lab out of California that I can do a micronutrient testing for about $400. So not horrible, but not cheap.
Yeah, and that's blood-based, right?
It is blood-based, yep. So, and it's both intracellular and extracellular. So I'm looking at both.
No, I think that's super. On my wish list of things is to find a partner one day that is saliva and urine, because I just think that, I think the technology is there and it can become so much more accessible and cost-effective, and people can do it.
If you find that, let me know. Yeah. Those tests can be upwards of $1,500.
Yeah, it's crazy.
It is. Yep.
Yeah, but that was really impactful when we were going through what we were doing with our son. It was a lot of blood work, and what we found was a lot of interesting things around low nutrition, low vitamin levels. When I thought he was eating properly, he had a genetic mutation, MTHFR, that was preventing the absorption. And so got to learn all about that and how to, work around that. And he's thriving today, but had it not been for really getting to the root of the nutrients that he wasn't absorbing correctly, it never would have been a holistic type view. So I think that's...
We're finding that kids with the ADHD is actually more of an omega-3 issue versus actual ADHD and DHEA issue. So, and we have a great supplement that we use for that, and it really is wonderful. So we're not pumping these kids full of stimulants. We're actually taking care of that root cause of the problem.
No, that's super. Anything then when you are seeing pediatrics, do you tend to kind of say, hey, by the way, this might be genetic. You might want to check this out too, mom and dad, or how does
we do, depending on what they come in for. Most of my kids, I'm so blessed, they're just well child. So it's so much fun. Occasionally, we have the child that, mom and dad don't want to do traditional ADHD meds. So we look at, supplement in A lot of my patients can't necessarily afford the blood tests, so we trial and error. We know, what usually is a problem, so we'll try that for a few months, and then, if it works, fantastic. If it doesn't, we'll tweak it a little bit.
Yeah, that's super. Digestion, how do you approach that? What do you look at?
Multiple things. Is it beginning of the GI tract? Is it the end of the GI tract? Mm. It depends on where it starts. We're looking at GERD, gastroesophageal reflux disease. Are we looking at a gastric emptying problem? Are we looking at absorption problem? Are we looking at an elimination problem? So we really have to dive deep to really talk about it. My patients are sometimes horrified. I want to know about your bowel stools. I want to know the color. I want to know if it floats. Yeah. I want to know if it's formed or if it's nuggets. So I have to know, really know what's going on to really identify where that digestive problem is happening.
Yeah. And then in certain clinics now, there's different types of treatments for different things, and folks are becoming more and more educated as they're doing research online. And, are there certain treatments that you have found are kind of cutting edge that you're playing around with that, you think folks might want to learn more about, or?
Not really. It's still pretty basic for me. Fiber is a key thing. Aloe is wonderful. I use a product from Thorne called GI NCAP that really helps. Digestive enzymes for that stomach and digestive part.
Cool.
And nothing special, really. It's just getting to know the patient.
Yeah. What do you find in terms of like allergies? What do you like to do for that?
I have the best supplement. It's something that we branded ourselves. It's called HIST. It's a combination of bromelain. I don't have it memorized, but I have a bottle back anyway. So it is vitamin C, of course, quercetin, stinging nettle, bromelain, and N-acetylcysteine. And it is fantastic. I used to be, and I have severe allergies.
Yeah.
I used to be the one that goes, nothing works except over the big guns. Yeah, I was the era of Seldane, which they pulled off for cardiac issues. Only thing that ever worked for me. I would be a red, weepy mess. Nothing worked. Legger came out, worked great. Flonase worked great, but didn't quite get it. I worked with a major nutraceutical company to help me formulate this. I take one a day. I'm golden. One, not a handful. One, and they're green. It's really awesome. They work like a charm.
I love that.
No side effects. No drowsiness. No constipation. Yeah.
It doesn't make your heart race or anything crazy.
Not at all. Not at all. It doesn't make you sleepy.
No, that's great.
Although sometimes I wish it would. So I take it at night.
So some of the things that I think are kind of nutty right now is how passionate some people feel about certain diets versus others. Do you have a certain diet that you really prescribe to, or
depends on my patient?
Yeah.
Are they diabetic? Then yeah, we're going to go low carb, because really in simplified terms, diabetics, you're basically allergic to carbs, right? Body doesn't know what to do with it. No one's taken the time to explain diabetes to most patients.
Yeah.
You just know that, their pancreas isn't making enough insulin, so they have a lot of extra sugar. Mm-hmm. But they don't know why that causes damage to the eyes, the kidneys, and the nerves. So part of our biological process, we need insulin. So just a key to get in that door to go into the house, right, of the cell. Your eyes, your kidneys, and nerves have no locks on those doors. That insulin or that sugar can go right in. And if you've ever seen sugar molecule or glucose molecule under an electron microscope, it looks like a ninja Death Star with all these spikes. So of course, when it sits there, it'll cause all kinds of damage, which we see in diabetics, right? So the goal is to tweak their diet through starting to reduce the amount of carbs that they're eating to the level of where they're not storing it other places.
Yeah.
Their eyes, their kidney, and their nerves. So we're stopping that nerve damage. And it's a lifetime progress. And we can get most patients off most meds, if not all meds, through diet and exercise.
Mm-hmm. And then is there anything in the diet itself that you really feel passionate about as you're chatting with folks that have a lot of pain or inflammation? Or
Yeah, so a low inflammation diet, right? Mm-hmm. So we want to look at foods that cause less inflammation. So again, everything is targeted for each individual patient. I don't have one diet that I prescribe to everybody. I can't, because no one's the same. No one has the same problem. So when we're looking for people with pain, we want that low inflammation diet, probably some turmeric added, some black pepper, things to really work on that inflammation, as well as a good fish oil. That really, people don't realize, but that really does help. And then movement, right?
Yeah.
The old adage, move it or lose it. It really is the truth. We got to have some movement. And I'm not asking my patients to go to the gym, lift 100, weights. I'm really encouraged a 30-minute walk. It's amazing what a 30-minute walk will be. You do that for a while, maybe take 2 bottles of water with you, a little bit of weights in your hands. It doesn't have to be this intense workout for your journey to health. It can just be simple as walks. You don't have to do the walk every day at the same time for 30 minutes. Break it up. You got 10 minutes, great. Park out in the boondocks, the parking lot. Walk in, walk out. It's a combination of these things, and it's little changes over time for health. You didn't get unhealthy overnight. It's a process. It's a process to bring you back. So we pick little nuggets. We pick one thing a month. We incorporate it in, see you back, see how you did, incorporate something new. So we're making habits. So we're making permanent changes versus me dumping everything on you at one time, expecting you to make all these changes, and you won't, or you will for a week or two, and you're done. It's just too hard.
Yeah. So when someone is listening and they're wondering what an anti-inflammatory diet might look like, instead of just going to Google and typing that in, do you have any helpful hints or things to think about?
Really, Google typing it in is going to bring up a whole bunch of things. And you have to take in concerns for allergies, likes, and dislikes. So again, every patient's individualized.
Yeah.
And I really look at that. I ask them, what'd you have for breakfast today? What'd you have for lunch? What'd you have for dinner? Snacks. And then we talk about taking things out, adding things in. And again, just small steps.
Yeah, I know what made a big difference in our family in just allergies and weight and our skin looking healthy and less acne was just really minimizing the amount of sugar. In my house, I was raised in an Irish Catholic family, and it was all about showing love through baking. And so I've now had to kind of adjust and think about how I show love through savory baking instead of sweet baking. But
right. Well, and it can still be done. I mean, organic honey, not pasteurized, is a great one. Some of the alternative sugars, monk fruit, things like that, you can still use in moderation, because you're absolutely correct. Sugar is one of the worst things for inflammation. And if you look at a typical American diet, every meal you're eating tablespoons or cups of sugar, hidden sugar, but it's there.
Yeah, no, that's wild.
And we see it with gluten as well. I get a lot of people come in with headaches, severe migraines. It's a gluten, not an allergy, but an intolerance. Yeah. So we have to really pull it all out, maybe add a little bit back in, depending on their tolerance level.
Mm-hmm. And I know for me, my migraine stopped once I stopped drinking Diet Coke. That was a long thing for me for a long time.
Yeah. And again, that's why you have to really dig in and find out what people are eating and drinking, right?
Yeah.
Because you can't just assume.
Yeah.
I get that with people too, with a lot of allergies and mucus. I find that is actually a milk protein allergy, not lactose, but whey and casein. And if we can remove that, we clear that up.
Yeah. Yeah, no, it's amazing. Well, thank you. Any last tips? How do people find you if they want to learn more information, visit with you?
My website, wholistictelehealth.org is the best way. My phone number is there. You can reach out. Absolutely.
Okay, super. Any last tips, anything you want to end with that folks should think about when it comes to health and wellness?
Little steps, making permanent changes. Don't try to do everything at once, because you will do it for a little while, but then you'll stop. Looking to make healthy choices. And each time you set for a meal, if you make one healthy choice, that's a win for the day. If you get out and walk, that's a win. Be easy on yourself. It took a long time to get where you're at. It takes a long time to get where you need to be. Little steps at a time, so you can make these healthy choices and just add to it. When you get one focus done, move on, right? They're just little steps that we all need to make. That's the best way to achieve health.
Wow, that's fantastic. Thank you, Susan, so much for your time and for being with us. We really appreciate it.
Thanks for having me. It was fun.
That's it for this episode of Encouraging Wellness. We hope this serves as an eye-opener to you on new ways to approach your health and wellness. By learning both unique and the best alternative wellness and healing methods, you can live your best life. Listen to more of our episodes at www.hello.health. Be sure to subscribe to the show and leave a rating. Together, let us work towards unlocking you and your family's best self. Thank you for listening. See you on the next one.